Hi, and thank you for joining us for Cave Talks. I'm Kimberly, and I am the program director of My Quiet Cave, where we create space for faith and mental health. And today we have Diana Cloud with us. Diana is a licensed professional counselor practicing in Arvada, Colorado.
That's correct.
And I would love to talk to you today about anxiety disorders. And what I think is so cool about having you talk about anxiety disorders, not only does Diana know a lot about the subject, you're also very passionate about it. You like working with this population, correct?
That's correct, I do. I've always really enjoyed working with anxiety disorders. There's several different types of anxiety disorders. And I think what I enjoy about it is the interventions. There's a lot of different interventions for anxiety disorders, and there's a lot of room for like psychoeducation that can really help people get a greater sense of control.
So psychoeducation, can you tell me what you mean by psychoeducation for those of us that are not clinical?
Yeah, so when we're dealing with anxiety disorders, it's really important to understand that it's not only cognitive or thought processing, information processing kind of disorder, but it's also a very physiological disorder. There's a lot of physical reactions to anxiety that when people have some education around understanding, for example, the sympathetic nervous system, it really empowers them. It makes them feel more confident in being able to manage the disorder. And there's a lot of fun interventions like deep muscle relaxation and deep, what we call diaphragmatic breathing, those types of interventions that can be very, very helpful. And it's just really fun to see people as they grab a hold of these interventions and begin to use them to actually gain confidence in being able to manage their anxiety disorders.
So you really love seeing that change.
I do. Yeah, it's a lot, I would even say kind of fun to see people grow, better understand their own disorder, and be able to manage it.
So when we're talking about anxiety disorders, can you give me a definition
Yes.
of anxiety, like more of a clinical definition?
Yeah. So all providers who diagnose mental health use what we call the Diagnostic and Statistical Manual. The 5th edition put out by the American Psychiatric Association. And at the very basics, anxiety disorders are defined as disorders in which there's excessive fear and excessive anxiety that is persistent across time. And really what we see in anxiety disorders are you have fear, which is more defined, the DSM-5 defines that more as an imminent threat. Or perception of threat, where anxiety is more of an anticipation of a future threat. And so what we see a lot of times in anxiety disorders is that somebody will kind of be dealing with both of those. Those can overlap. Certain disorders may deal more with the fear, and others may deal more with anticipatory anxiety, but they do overlap.
So when you're talking about the anticipation of an event happening or something like that, you have fear of that, can it be something that is real, or is it something that I just make up in my head?
Well, usually there's probably some bit of material or situational material there that can inspire, if you will, the anxiety. But one of the things that we do see in anxiety disorders is there's definitely an information processing style. And John Ludgate out of the, I think it's Academy for Cognitive Therapy, I really like how he just put this in a very basic terms. He said people with anxiety disorders tend to overestimate the risk or the probability of something happening, something negative happening. They also overestimate the severity, if that should happen. Then they also underestimate their resources. So they underestimate their ability to cope if that should happen, and they underestimate their ability to access support if that should happen. And they also have just a very low tolerance for the unknown. So we see that across, the DSM really identifies about 9 specific anxiety disorders. However, within each disorder, we can have what we call comorbidity, where somebody might have, for example, social anxiety disorder, but they also might have a panic disorder. So we can see the comorbidity across the disorders, and we also see different levels of intensity An anxiety disorder can be mild, moderate, or severe. One of the things that we definitely see, though, with anxiety disorders is this kind of behavioral strategy, and the most common one is avoidance. And so part of therapy is really helping people to avoid avoidance, if you will, and to begin to allow themselves to be exposed to some of the things that they're afraid of.
Thank you. I think you've done a really great job of explaining the difference in what stress might look like and why, and an anxiety disorder.
Yes, that is something very important for people to understand. I think people who have actual anxiety disorders are often very misunderstood, in that they often feel isolated within their disorder because those around them might say, well, just quit worrying. Oh, it's no big deal. And what that can do is actually add a sense of even shame onto the person's anxiety. And it's really important to understand, we all most definitely experience stress, we all experience anxiety and fear, but usually it's not as persistent, the severity levels aren't as intense, and there's not necessarily a lot of almost compensatory or safe behaviors that we call that people develop around the disorder. And so you don't see that with people who don't have the disorder.
So can you give me an example of what this looks like in a person with an anxiety disorder, instead of somebody that's, just stressed out or has anxiety around certain things, like a busy schedule, or they're taking care of children and work and trying to juggle everything, that might be stressful, but anxiety is very different. Anxiety disorder is different. So can you give me just, what does that look like in the everyday person?
Yeah, I think people with anxiety disorders tend to be often very uncomfortable. Their symptoms can kind of wax and wane depending on things such as stress level, but again, there's kind of a consistency and a persistency of the disorder. But people with anxiety disorders often live in the what ifs. What if this happens? And then if this happens, what if that happens? And as they're going through this, what we call catastrophic information processing, they often have even images that come up with the catastrophizing. And then they have often physiological responses to that. So anxiety disorders are very much connected to our sympathetic nervous system. And many people with like a generalized anxiety disorder find that they're often tired, that they have a hard time concentrating. They spend a lot of time worrying. They have a lot of muscle tension, and so they're just physically often uncomfortable. And then when we look at disorders such as a panic disorder, we're looking at people actually moving into a strong fight or flight experience, which is an experience that we were wired to have if we were to see a lion, for example, out in the African safari. We would want that response, but what happens with people with anxiety disorders is that response is overactive. And so the brain becomes very obsessed with finding threats either here and now or the future. And so they're often caught up in this sympathetic arousal place, and it can be very uncomfortable. Socially, you might see people with anxiety disorders trying out maybe overcompensation behaviors, or again, like I said, a really kind of key behavior we see is avoidance. So they may be avoiding things that they would love to actually attend or be a part of, but they're just so concerned about managing their anxiety, and exposing themselves maybe to another threat, if you will, is just too much. So a lot of times they pull back, they hold back. Anxiety disorders can absolutely impact parenting, marriages, somebody's career, their occupation, and actually it's a lot of people go on disability, like short-term disability, to try to get their anxiety managed. So yeah, it can be a very uncomfortable disorder, and again, often misunderstood, because somebody without the disorder can say, well, I've been anxious or stressed or nervous before. But
Just
they
stop
don't.
worrying about
Yeah,
it.
just stop worrying, which actually usually increases the anxiety of the person who has the anxiety disorder.
How is that?
Because those comments, again, not only are you feeling anxious in the moment, but they kind of send the message like you should be able to have more control over this. You should be able to, I can do this, why can't you? So it kind of adds to that sense of what's wrong with me. And what it can do is kind of bring about what we call meta cognitions, or thoughts about our thinking, or feelings, meta emotions, feelings about our feelings. So if somebody's anxious, a lot of times what I see is then they feel anxious about being anxious. Or if somebody has anxious thoughts, then they think, what is wrong with me? Why can't I handle this? Other people can. So they have those negative thoughts about their anxious experience. So sometimes those can be exacerbated by people who usually they're well-meaning. They're trying to support, but it actually kind of backfires.
So that is not helpful.
That's
Tell
not
somebody,
very helpful.
just don't worry about it.
Yeah.
Be anxious about nothing.
Exactly.
So
exactly.
what does work? What's helpful? Let's talk about resources a little bit.
Yes.
Interventions. I know you
Yeah.
said some of the interventions for anxiety disorders are some of your favorite.
Yeah, well, I think if we just start with, if you have a loved one who has an anxiety disorder, a lot of times just asking, hey, how can I support you right now? I noticed you're feeling anxious. What can I do to help you feel better? Listening, just being a calm presence for them. We all have mirror neurons, so if somebody's anxious but another person is calm, that in itself can be very calming for them. You don't want to become the safe behavior of the person with the anxiety disorder. For example, if somebody has a lot of anxiety about going to the store and they kind of adopt you as, I can only go to the store if you're with me. I mean, those are the types of things you want to be cautious of, but you can most definitely be, I'm here for you, I'm thinking about you, and just being, again, that calm, kind of consistent, accepting presence really is helpful. And then when you get into more of like the therapeutic interventions, we absolutely want to look at the cognitive processing or the thought processing, because again, research really supports that there's core beliefs such as the world is a really dangerous place that make people vulnerable to anxiety disorders. There's what we call automatic thoughts, such as, if I do this, I'm not going to be able to handle it, that you want to help people therapeutically look at, evaluate the evidence for. In therapy, a key strategy for the cognitions is doing what we call a decatastrophizing cognitive behavioral therapy type of intervention. But within that also we have, depending on the disorder, I mean, the disorders are very much related, but a lot of them need just a little bit of their own specialized intervention. But for example, with a generalized anxiety disorder where somebody finds that they worry across all domains of their life, it's very persistent, it's intense, doing strategies like worry control, assigning times when you worry, and then kind of containing that can be very helpful. So there's those type of strategies, and then arousal reduction is a really big part of intervention. Again, back to that, teaching people how to deep breathe, teaching people muscle relaxation skills. Remember earlier I mentioned with those catastrophic thought processes, people will have images with that, and that in itself can be enough to arouse that sympathetic nervous system. And so teaching image substitution. When you think of this, and you imagine everything falling apart, instead imagine yourself, being in a calm, grounded type of state. So there's a lot of those types of interventions. Eye movement desensitization reprocessing, EMDR, used to be more focused on trauma processing, but we found that can also in itself be helpful. And then again, it depends on the disorder. If somebody has, for example, a panic disorder where they've had recurrent panic attacks and now they have anxiety about having the panic attack, and it's at such a level where they have internal cues such as a bit of hyperventilation, or something like that can start the panic attack, you want to do a different bit of what we call interoceptive exposure. So exposure therapies to support avoiding the avoidance, cognitive therapy, arousal reduction, those types of therapies are what can be helpful. And then we can't ever underestimate the power of that basic self-care, right? Physical exercise. There's some research that supports that there may be a buildup of lactic acid in people who have anxiety disorders. And so physically exercising can be really helpful in kind of getting that out of your body. Physical exercise, again, can help you practice mindfulness, which is just a very growing concept in therapy that has been around for a long time, but right now it's kind of right in the center of our perspective of understanding mindfulness. Being here and now in the moment can be very, very helpful strategy in managing anxiety.
I know you gave us some great ways that we as supporters can help somebody or a loved one with an anxiety disorder. I know we want to be very careful about not trying to diagnose anybody, not trying to be a counselor or therapist.
Yes.
So what kind of resources could you tell us about if we suspect a loved one is struggling with anxiety and it might be an anxiety disorder? What could we do practically to help?
Yeah, well, I would absolutely encourage your loved one to be evaluated by a mental health provider. Mental health providers, I think, they're able to really differentiate what type of anxiety disorder it is, and then kind of establish what type of interventions fit with that very specific disorder. So I definitely think getting therapy, I would say if you have symptoms, 6 months really for generalized anxiety disorder, having certain symptoms for a duration of 6 months is enough to say it's time for intervention. And that kind of depends on the person as well. Sometimes being proactive, I'm very much about being proactive. So if you suspect that your loved one or yourself has an anxiety disorder, would certainly support getting in, being evaluated, getting an accurate diagnosis, and then kind of going from there. Unfortunately, research does support that, I think it's around 23% of people who have anxiety disorders actually never seek treatment for it. So they just remain uncomfortable. And there's a lot of things out there that can be done for anxiety disorders. So encouraging your loved ones to take those steps. There's nutritional steps as well that can be helpful. So yeah, maybe just helping them sit down and do a little bit of research on all the different options that are out there.
What does recovery look like for an anxiety disorder?
Yeah, so sometimes full recovery or full remission is possible. A lot of times what I more often see is that anxiety disorders move into what we call a management kind of place where when managed, it can fall to a subclinical level. And so that the intensity, the persistency can fall, but there's often just, remnants of that there. So I like to usually look at it more as like a management, but most certainly there are a lot of steps that can be taken to support managing it, getting it to a subclinical, kind of level. I think, again, education, if you suspect that you have an anxiety disorder, just using resources like the National Institute of Mental Health, the Anxiety and Depression Association of America, using some really good resources to investigate, to better understand what is happening can be very helpful.
Anxiety is the most prevalent mental health disorder there is, right?
It is. That's from, yes, anxiety disorders are the most commonly diagnosed mental health disorders. Again, the Anxiety and Depression Association of America estimates that about 18% of adults in any given year in the United States does suffer from an anxiety disorder. The National Institute of Mental Health suggests around 30% of adolescents, ages 13 to 18, suffer from, a full anxiety disorder. So it is very prevalent. Yes.
So chances are we know at least one person in our lives struggle, if not
Absolutely.
we
If
struggle
you
with
yourself
ourselves.
don't struggle with one, it's very highly likely that you know somebody who does struggle with an anxiety disorder.
Well, Diana, is there anything that I haven't asked you that you wanted to add?
I think a common question that people ask me is, how did this develop? How did I get this anxiety disorder? And I think it's really important to understand that there are multiple factors that usually go into the development of an anxiety disorder, and that's where seeing a professional can be really helpful. But what we do see is that, of course, a well-known kind of idea would be that brain chemistry might be a contributing factor, but we also have good old-fashioned temperament. We've seen that there's temperament traits such as behavior inhibition, a tendency to see things or experience negative emotions, a harm avoidance. All those things are more grounded in just a person's temperament. So those can also make somebody a little more vulnerable to anxiety disorders. And then we also have, a lot of times what I see is maybe a genetic genes mixing with environment. And a lot of people were taught to be anxious. They were modeled. And so what you can see is maybe somebody who has behavioral inhibition, their temperament is more aligned with behavior inhibition. Well, their parents may also be the same way, and their parents may have modeled social anxiety type of responses to situations. And so you can see kind of a mixture. But life events, stress, trauma can also be contributing factors to the development of a disorder.
Diana, thank you so much for being here. I was really happy to be able to interview a close friend as well.
Oh, yes, it was just such a pleasure to be here. Thank you so much for having me. And again, I just love the work that My Quiet Cave is doing. So
thank you. If you have questions for Diana, I can put her information up below. She is practicing at Transition Counseling Center in Arvada, Colorado. And also, if you have any topics that you want us to discuss, you want to see done as a cave talk, please go on our website at myquietcave.org. You can contact us there and shoot us an email. Let us know what you think. And if you've got suggestions, we'd love to try and cover your topic. So thank you for joining us. Thank you again, Diana, for being here.
Thank you.
And we will see you next time.